I'm Dipti Itchhaporia, and I'm on the ACC's Board of Trustees. I'm an interventional cardiologist based out of Newport Beach, California, and I am a faculty member for the ACC Middle East Conference here in Dubai. We just finished a presentation on the common dilemmas and difficult cases in managing stable ischemic heart disease. It was a very good session where we actually had some very interesting cases, and we talked about the diagnostic dilemmas involved with these types of patients, how to differentiate patients with stable ischemic heart disease, what the diagnostic testing should be in these patients, how do you assess their pre-test probability to decide what the next testing should be, and then what the medical therapy should be on those patients. We actually did an in-depth discussion of 3 different clinical scenarios. One was a patient that had atrial fibrillation that ended up needing a PCI after their testing. So we worked through what that patient's pretest probability was, what the workup should be, and then when we did the coronary angiography, the patient required an angiogram, and so we discussed how do we manage the patient's triple therapy versus dual therapy management in terms of their dual antiplatelet therapy and their anticoagulant therapy. We had one clinical scenario where a patient had pancreatic cancer and had some clinical symptoms which led to some stress testing that was positive and needed a PCI, and we had a long discussion on what the appropriate therapy was for that patient prior to that patient having their Whipple procedure. So it was a fascinating session. The session had a really good discussion because of some of the questions that were generated, and I think a lot of the questions surrounded the issue of triple therapy for patients with atrial fibrillation that also had stable ischemic heart disease and that required a PCI. And there was an in-depth discussion about the new guidelines that guided therapy of dual antiplatelet therapy for 6 months in these patients. We had a lot of discussion with regards to really what should we do if somebody's having surgery and they also needed a PCI, and whether we should do a bare metal stent, a drug-eluting stent. So I think there were some really good questions, but I think at the end of the day, the point that was brought across was that it all starts with basic good history, physical examination, determination of their pre-test probability, and then the diagnostic workup, and that all of these patients ultimately needed to be on optimal medical therapy. It's really important to have these type of international exchanges where we get to sit down and talk about common problems that face all of us. And in this case, it was about stable ischemic heart disease, but we had the opportunity in the international setting to talk about what their experience is, what our experience is in the United States, and really exchange some ideas about. And then there's some differences in terms of some of the equipment that we have, some of the drug therapies that we have, so we had a nice exchange of ideas.